I want to tell you about a man named Robert. Robert was 68 years old, living just outside of Seattle. When he first entered my clinic, he didn't walk in. He was wheeled in by his daughter, Sarah. Robert's face was a mask of chronic fatigue and gray, lingering pain. He had been a high school track coach, a man who spent his life on his feet. But now, his orthopedic surgeon told him he was bone on bone in both knees. The diagnosis was grim. A double knee replacement was scheduled, but because of his high blood pressure, the risks were terrifying. Robert told me something I'll never forget. He said, "Dr. Thompson, they're talking about moving me into an assisted living facility. I'm 68. My spirit is young, but my knees have turned into dry, crumbling chalk. Am I just done?" He felt like a burden. He felt like a prisoner in his own home. He was terrified of the medication merry-go-round, the opioids, the NSAIDs that tore up his stomach, the steroid shots that only worked for a week. Fast forward 6 months. Last Saturday, I received a video from Robert. In it, he isn't in a wheelchair. He isn't even using a cane. He is standing at the summit of a moderate trail in the Cascade Mountains, breathing in the crisp air, with a grin that could light up a stadium. He's independent. He's vibrant. He's driving his own car and playing tag with his grandkids. Oh. We didn't find a miracle drug. We didn't do the surgery. We addressed a fundamental biological starvation that 97% of modern doctors, even the best surgeons, usually overlook. We didn't treat the pain. We treated the environment that allowed the cartilage to die. We used a simple, natural method focused on 2 specific nutrients that your cartilage is literally screaming for. In this video, I'm going to guide you through the detailed implementation of the same protocol that gave Robert his life back. Before we get into the science, I need to know who I'm speaking to so I can tailor my advice in the comments. I want you to stop right now and comment below with your age, your most frustrating symptom, like stiffness in the morning or stabbing pain on stairs, and one thing you can't do anymore that you wish you could. I read every single one of these. Whether you're a 55-year-old office worker whose knees ache after sitting for 8 hours, or a postpartum mother whose joints haven't felt right since your hormone shift, or like Robert, someone over 50 facing a scary diagnosis, listen to me. Your knee pain is likely not due to bad luck or genetics. In my 30 years of practice, I found that cartilage loss is almost always a result of a specific deficiency in 2 key nutrients. When these are missing, your cartilage loses its ability to hold water, becomes brittle, and begins to shred. Today we fix that. As I mentioned, I'm Dr. David Thompson. I've spent over 3 decades treating thousands of patients. My mission for this channel is to help you reclaim your health and independence through the power of scientific nutrition. I don't want you dependent on a pharmacy. I want you dependent on your own body's incredible ability to regenerate, provided you give it the right building blocks. Everything I'm about to share is backed by molecular biology and clinical results. No fads, just science. Are your knees actually starving? Let's find out. I want you to count how many of these 5 symptoms you experience regularly. 1. The morning rust. When you get out of bed, your knees feel like they need oiling for the first 20 minutes. 2. The staircase warning. Going downstairs causes a sharp, biting pain behind the kneecap. 3. The theater sign. After sitting in a movie or a car for an hour, your knees feel locked or incredibly stiff when you stand. 4. The grind and click. You hear a sound like sandpaper rubbing together when you squat, crepitus. 5. The weather barometer. Your knees throb or feel heavy right before it rains or the temperature drops. How many did you count? Comment your number, 1 through 5, below. If you have 3 or more, you are likely suffering from a combination of chronic ischemia, starved blood flow to the joint, and oxidative stress. Think of your knee cartilage like a wet sponge. When it's healthy and full of the right nutrients, it's bouncy and slides effortlessly. When you are deficient in the 2 nutrients we're about to discuss, that sponge dries out. It becomes a dry, crusty kitchen sponge. When you try to bend a dry sponge, it cracks and tears. That is what bone on bone actually looks like at the cellular level. The first nutrient is perhaps the most misunderstood in all of orthopedics. It's vitamin K2, specifically the -7 Malawian Quatches form. Now, don't confuse this with vitamin K1 found in spinach. K2 is a completely different beast. I remember Margaret, a 62-year-old dental hygienist. She had calcified tendons, and her knee x-rays showed what looked like little rocks inside the joint space. She was taking massive amounts of calcium supplements, thinking it would help her bones. But that calcium wasn't going to her bones. It was landing in her joints and arteries. After 3 months on a high K2 food protocol, her joint flexibility increased by 40%. She told me she could finally flow through her day again. Why do I call K2 the calcium traffic cop? In your body, you have a protein called osteocalcin and another called matrix GLA protein, MGP. Imagine these proteins are like empty dump trucks. Their job is to pick up calcium from your joints and blood vessels and dump it into your bones and teeth. However, these trucks are born without drivers. Vitamin K2 is the driver. Without K2, calcium is like a rogue hitchhiker. It wanders around and settles in your soft tissues, like your knee cartilage. This is called ectopic calcification. It turns your soft, bouncy cartilage into hard, brittle stone. K2 activates the proteins that pull that stone out of your joints and put it back into your skeleton. A landmark study published in the Journal of Nutrition and Metabolism, 2017, demonstrated that vitamin K2 is essential for the inhibition of vascular and soft tissue calcification. Furthermore, research in osteoarthritis and cartilage has shown that individuals with higher K2 levels have a significantly lower risk of developing knee osteoarthritis and cartilage lesions. We aren't looking for pills. We're looking for the most nutrient-dense foods on the planet. Source A. Natto. This is a traditional Japanese fermented soybean. It is the single richest source of K2, -7 Malawian Quatches, on Earth. Source B. Goose liver pate or hard cheeses. If you can't do natto, aged cheeses like Jarlsberg or Gouda are excellent. Source C. Pasture-raised egg yolks. The eggs must be from chickens that eat grass and bugs. Industrial eggs have almost zero K2. The recipe. I recommend a K2 savory bowl. A small serving of natto, or 2 ounces of aged Gouda, with 2 soft-boiled pasture-raised eggs. Golden time, noon. K2 is a fat-soluble nutrient. You need to eat it with your largest meal of the day that contains healthy fats, like avocado or olive oil, to ensure it gets absorbed. What to avoid? Do not take K2 with a high-fiber bran cereal, as the fiber can bind to the fats and prevent absorption. Have you ever heard of natto? It has a very unique texture and smell. Some love it, some not so much. Let me know in the comments if you've ever tried it. The second nutrient your cartilage is craving is organic sulfur, specifically found in compounds called glucosinolates. I call this the cartilage glue. Think back to Robert, the veteran I mentioned earlier. Along with K2, we flooded his system with sulfur-rich cruciferous compounds. Robert used to have what he called loose knees, They felt unstable, like they might give out at any moment. This is a classic sign of weak, connective mesh. Within 8 weeks of his sulfur protocol, that feeling of instability vanished. He felt solid for the first time in a decade. Your cartilage is held together by molecules called glycosaminoglycans, GAGs, such as chondroitin sulfate. Look at that word, sulfate. Sulfur is the chemical bridge that links protein strands together. Imagine a suspension bridge. The steel cables are the collagen, but the bolts and welds that hold the cables to the road are the sulfur. If you are sulfur deficient, your bridge, your knee, starts to wobble. Furthermore, sulfur is a precursor to glutathione, your body's master antioxidant. Think of glutathione as a waste filter. It neutralizes the oxidative acid that eats away at your chondrocyte, cartilage cells. Without sulfur, your knees are literally being burned by metabolic waste. The Journal of Bone and Mineral Metabolism, 2013, published findings showing that sulfur-containing compounds significantly reduced the expression of inflammatory cytokines, like IL-1 beta, in joint tissues. Another study in The Lancet highlighted that sulforaphane, a sulfur-rich compound, can block the enzymes that cause joint destruction. Practical guide. The sulfur superstars: garlic, onions, leeks, and specifically broccoli sprouts. The dosage: a half cup of broccoli sprouts daily or 2 cups of steamed cruciferous vegetables, Brussels sprouts, cabbage. The doctor's secret recipe: the garlic sprout elixir. Crush 2 cloves of raw garlic and let them sit for 10 minutes. This activates the allicin. Toss them with a handful of broccoli sprouts, a squeeze of lemon, and a tablespoon of extra virgin olive oil. Golden time: evening. Your body does the majority of its tissue repair and collagen knitting while you sleep. Providing the glue, sulfur, at dinner gives your body the tools it needs for the night shift. Note on combination: you must crush or chop your garlic/broccoli and let them sit before eating or lightly steaming. This injury to the plant triggers the enzyme reaction that creates the healing sulfur compounds. How many of you actually like garlic? Give me a heck yes in the comments if you're a garlic lover, or tell me if you're worried about garlic breath. I have a trick for that involving parsley. We've covered a lot today. We talked about how Robert went from a wheelchair to the mountains by stopping the starvation of his joints. Remember, your knees are not just mechanical hinges. They are living, breathing tissues. If you give them the calcium traffic cop, vitamin K2, to stop the calcification, and the cartilage glue, organic sulfur, to rebuild the mesh, you are giving your body the biological permission to heal. Let's summarize the protocol. 1. Morning/noon. Get your K2 from natto, pasture-raised eggs, or aged hard cheeses. Always eat it with fat. 2. Evening. Get your sulfur from crushed garlic and cruciferous vegetables. Let them sit for 10 minutes before cooking or eating to activate the medicine. A gentle warning: this is not a quick fix. This is a deep fix. It takes time for these nutrients to accumulate in the joint space. Give it at least 90 days of consistency. You didn't lose your cartilage in a week. You won't grow it back in a week. But as Robert showed us, the wait is worth your independence. If you found this helpful, please subscribe to the channel. My next video is going to be a deep dive into the 3 hidden healthy foods that are secretly dehydrating your joints. You do not want to miss that one. Hit the notification bell, and please, share this video with one person you know who is struggling with their mobility. Let's help our community stay independent and out of the nursing homes. I'm Dr. David Thompson. Keep moving, keep eating for your cells, and I'll see you in the next video.